Hello, my name is David Rakel. I'm the professor and chair of the Department of Family Medicine and Community Health at the University of Wisconsin. I'm also editor-in-chief of Primary Care Practice Update. I wanted to review some of the lessons we've learned from the UK Biobank study. The United Kingdom took 500,000 of their citizens and did a lifestyle inventory, and then for 8,000 of those subjects, they did MRIs. This is the largest data set we have for MRI evaluations of brains compared to lifestyles on the planet in the history of this research. So we have a lot to learn from this. So I just wanted to summarize some of the key things that this study has taught us to keep our brains large and working well. The first is reduce risk factors for metabolic syndrome. They looked at the number of risk factors for metabolic syndrome: high triglycerides, low HDL, fasting blood sugar greater than 100, a high blood pressure, a large waist circumference. For each risk factor for metabolic syndrome, that directly correlated with the amount of shrinkage of the brain and the amount of cognitive dysfunction. So if we can reduce those risk factors for metabolic function, we can preserve the brain according to the correlations research done with the UK Biobank study. The next one is eating an anti-inflammatory diet. So this is a Mediterranean DASH type diet that's rich in multicolored, high fibrous whole foods. It's low in 3 inflammatory foods, and the most inflammatory foods are high in sugar, high in red meat, particularly processed red meat, and then excessive amounts of dairy, and then processed foods, which we'll talk about a little bit later. So people who ate more of an anti-inflammatory diet reduced the inflammation of the brain, which correlated with larger brains and more cognitive function over time. So eat multicolored whole foods that were recently alive with people you love. That's the mantra. The third is alcohol. They found that consuming more than 16 grams of alcohol a day was correlated with brain shrinkage and dementia. We also need the social support. So if you live in Britain, have 1 pint, no more, of beer with your friends. And that equals about 1.5 mixed alcohol drinks, or 1.5 glasses of wine a day. Next, ultra-processed foods. So they found out that people who eat ultra-processed foods, things that generally come in boxes and not from the ground, when they replaced 20% of eating ultra-processed foods with whole plant, high fibrous foods, it correlated with a reduction in dementia by 34%. That's pretty darn good. And then avoid stress. The UK Biobank study learned that people who were constantly under more stress had more degeneration of their cognitive function. So be kind to one another and work on ways to reduce our perception of stress. There are a couple other bonuses from other studies I wanted to share with you. One was a meta-analysis asking what's the best blood pressure control that reduces the risk of dementia. And this meta-analysis settled on 140/80. I like that one. Most of my patients want to keep their brain functioning, and when we have all these different guidelines in regards to blood pressure management, 140/80 seems like a good one to settle on. Another thing I think is really important in primary care, and I see this all the time with our residents, is when someone needs an anticholinesterase inhibitor, we forget to take them off the drugs that have a high anticholinergic burden. So for memory, we want to increase acetylcholine, but we use medications that reduce acetylcholine. Mainly muscle relaxers are the biggest culprits, some psych meds, trazodone for sleep. These all reduce acetylcholine. So we don't want to put people on medicines to increase acetylcholine when we have them on drugs to decrease acetylcholine. So we always want to look at the anticholinergic burden. Another key point of keeping the brain healthy are some of these non-nutritive sweeteners. For example, aspartame is a non-nutritive sweetener that gets converted to formaldehyde. That breaks down the blood-brain barrier. And we're seeing a higher stroke risk with some of these non-nutritive sweeteners because of this concern with destroying the intactness or the integrity of the blood-brain barrier. A lot of these non-nutritive sweeteners also have erythritol, and there's emerging evidence showing that erythritol increases clotting and also might increase the risk of major adverse cardiac events, stroke, and possibly dementia. So those are lessons we learned from the UK Biobank and more from other studies on how we can keep this very important organ healthy and happy and thinking well into the future.